Welcome to Healthcare Experience Matters. This podcast is brought to you by the Healthcare Experience Foundation. And with today's episode, we're teaming with PRC. This podcast is dedicated to transforming the healthcare experience so that every person can receive and deliver the best care. Hello, everybody. Welcome back to Healthcare Experience Matters. Today, we will be discussing why physician engagement is important, and our guest is Dr. Cindy King. Dr. King is Senior Vice President of Physician and Employee Solutions with PRC. And before we jump into today's discussion, I do want to ask her to just introduce herself and tell us a little bit about her professional background.
Sure. Thanks, Casey. Hi, my name is Dr. Cindy King. I'm the Senior VP of Physician and Employee Solutions at PRC. I graduated from the University of Texas at Austin with my PhD in educational psychology with a specialization in learning, cognition, motivation, and instruction. When I joined PRC, they brought me on board because they, at the time they had been assessing both loyalty and satisfaction of their physicians and their employees in healthcare with their clients. And they really wanted to start looking at engagement. And so I came on board to help build out our engagement index, which is part of our engagement products, and also working with the clients once they've received the results. So not only would we be providing reports, but we'd also be helping them with driving change. So building out their action plans and also just, figuring out how to move that needle. So really focusing on resources to support our clients.
How would you define physician engagement?
The way that we define physician engagement is that a physician needs to be both intellectually and emotionally committed to your hospital. And the way that that occurs is when they are provided that interpersonal through administration, nursing care, the staff that supports them, and the resources they need to provide excellent care. In addition to the services that are provided by that hospital, that they find that's excellent too. When all of that's working together, the physician can focus on their patients, and they become more committed to you because of that.
Dr. King, why do you think physician engagement is such a challenge for many healthcare organizations?
I think one of the issues is that, to make sure that it is something that's valuable to them, that they understand why they need to be conducting annual assessments on physician engagement. Physician engagement is not the same as employee engagement. Your physician leaders are a different group of either employed or they're independent, contracted with you, they're partnering with you. And because of that, it's a different set of concerns for them. It's just a different set of drivers. A physician is really, they're interested in being a part of the decision-making. They want to be part of the strategic planning. They want to have that direct link to the executive team where they can share their concerns and complaints, and also be a part of improvement initiatives to make it a better place to receive care at the hospital for their patients. One of the barriers there is that you have to be asking, not only providing that assessment where you're asking them to share with you their concerns, their suggestions, getting feedback from them, but you're acting on it. So once you ask the physicians, you hear their voice, that's not where it stops. It has to continue where you are not only asking them for additional feedback, that you're involving them in some changes that are being made, but you're also sharing with them the changes that are being made because of their feedback. That is where I see a lot of times with our clients where they fall short is they put into place all these amazing action plans and initiatives because of the feedback they received in the survey, but they don't actually follow through and share with the physicians everything that they've been doing for them.
And can you tell us about how physician engagement is measured?
Sure. So we have 4 items, and they're self-focused items. So they're asking the physicians how they think and feel about the hospital. We hit on a sense of ownership. So, are they feeling like they're a part of that strategic planning? They're coming up with solutions. They are a partner with you. And then, then one of the next question is about whether or not their role is rewarding. So do they find meaning in the work that they're doing? Are they, fulfilled with the practicing medicine? Then the third question has to do with curiosity. Are they still willing to invest their thoughts and ideas into the hospital? Are they joining those committees where they have an opportunity to share some future ideas, some innovating ideas that they want to see the hospital implement? I think something that you would hope all physicians feel, but that they care about the success of the hospital. Are they emotionally connected with you? Are they a part of this journey? Do they see their future in partnering with you? And so when you have all of those four kind of aspects of engagement, when they strongly believe in those questions, and that they're answering strongly agree to those questions, and that's what we call a fully engaged physician. When they're fully engaged, there's some great outcomes that come with that. They're the ones that you see more often. They're the ones that are participating in those committees. They're volunteering. They're out there in the community, and they're advocating for you. They're sharing stories, success stories about your hospital.
We often hear the phrase physician loyalty come up a lot in these discussions. So I'm curious, what is physician loyalty? How is it different, and how is it related to physician engagement?
So I believe that physician loyalty is an outcome of engagement. So what you have to do is first you bring on board and you partner with physicians that align with you with your same mission, vision, and values that your hospital has. Once you have that physician onboarded, you need to be able to provide those interpersonal supports, like I mentioned, the resources, the services that they can use for their patients, and you want it to be excellent. It doesn't have to be perfect. It just has to be where you're continuously striving for excellence. When those are all in place, then that physician is more loyal to you. They're not going to be referring to other hospitals for their patients. They're not going to be leaving the area. They want to stay within that community because they know they have the support to provide that excellent care. And when that happens, then they're more loyal to you, and they're more likely to recommend. So what we find with those physicians that are fully engaged, they're 2 or 3 times more likely to recommend you than even one that is a little bit less engaged. Those that are, where they're somewhat committed to you, but not fully committed to your hospital.
And why is physician engagement so important to the overall quality of care received by the patients, which of course is the end goal in all of this?
So what we find at PRC is that the number one driver of patients' perceptions of excellent care is when they see that the physician, the nurses, and the staff have excellent teamwork. So you want to have a physician that not only have all this support system in place, but they're a team player too. So they have strong relationships with the nurses, with the staff. They are, communicators where they're able to really share what their needs are for that staff and those nurses. The end result is that you want the physicians to have the bandwidth to be able to provide that excellent care, where they're not just coming in and checking off a list, but they're really, they are connecting with the patients, they're connecting with the families, and also engaging those patients in their care. It takes a little bit more time to have, that kind of softer edge there where you are really showing compassion to the patients, to their families, and communicating with them in that way. When you find a physician that is more unengaged, they're checked out. They're just not, they're just not in it for the right reasons anymore. They don't have all that support. They don't feel like it's excellent. And it shows in their interactions, not only with the staff and the nurses, but also with their own patients.
Are there any other benefits of a highly engaged physician that you wanted to mention?
Sure. So what we're finding is in our research around physician engagement is that those physicians that are more engaged, that have that support system in place, the service lines available to them, are less likely to be experiencing burnout. So they are, they don't have that emotional exhaustion because of the fact that they have such a support system in place. and they're able to provide that care. We find that those that are fully engaged are the like I mentioned already, the loyal ones, the ones that are retaining. But really, when it comes down to it, right now, particularly being in the middle of a pandemic, we have to be concerned about how emotionally exhausted our physicians are. We're seeing, a lot of media around this, around the frustration that's occurring and the overwhelming sense of helplessness, because there's just uncertain right now in these times, and it's leading to more burnout. We know that those physicians that are more burned out are also the ones that are more likely to be leaving the profession, retiring early, or even, which we don't want to see any kind of suicide or other self-harming. And so, with the burnout, there's concern around that, because what type of coping strategies are they using? And we want to have physicians be more resilient. And are they coping with what's happening now in this uncertain time, or are they, avoiding it? Which, with the fact that we don't even know when this is going to end, this pandemic, it's really important that the physicians kind of have that cushion around them right now, so that they can not worry so much about the uncertainty, because that's what administration and leadership can focus on, and they can just focus on the patients.
What are some of the key drivers of physician engagement?
What we recommend at PRC is that you don't focus directly on the physician. We want to focus on things that are within your control, the executive team, the department leaders, the service line directors, what they can do to provide support to that physician. And so what we find is that the number one key driver for engagement is how they rate place to practice. So how they rate place to practice and overall quality of care. The drivers of those two questions oftentimes come up is nursing care, which makes sense. So if you have a high turnover rate of your nurses, that's very unsettling for physicians, because they want to feel that these nurses know them, that they have confidence in the nurses' abilities. Part of some strategies around that would be to focus on onboarding and having physicians be a part of that onboarding, making sure that the nurses are building rapport with the physicians and building those relationships. Another area that we find as a key driver is patient experience. And so, how is the patient perceiving their care? What is the patients coming back and telling the physicians about their care in your hospital? You really want to make sure that you're aligning reality with their perceptions. So looking at patient experience metrics, having conversations with the physicians to find out what you can improve so that their patients are receiving excellent care. Just like the same thing with the patient safety. When the physicians feel that their patients are safe and that they're well cared for, then they're more likely to be engaged with you. And then lastly, but not least, is really building that relationship with the administration. You want to be visible to them, accessible. And right now in these times, it can be difficult because we're in the middle of a pandemic and some physicians aren't seeing those administrators right now. The rounding isn't occurring in the same way. And so it can be where you have to really think outside the box and maybe do something you've never done before. I was talking to a CMO out of Michigan last week, and she said what she's done, because she just felt like she was so disconnected from the physicians, and she started a monthly outing at a beer garden. So she goes to the beer garden once a month, and anybody can join her. It's outside. And they can have a conversation. And she says it's really been helpful for her to reconnect with her physician staff.
And of course, we have to ask this question, but how do you know, or how can you tell if physician engagement is lacking at your institution?
Well, first of all, you want to, check to see if you're measuring it, because you really want to gain that awareness. You need to see where you currently are today. And then not only measurement, but reflecting on that and rolling out the results and sharing it and action planning on it. I don't know if there's any hospital that shouldn't be assessing engagement. You want to keep your physicians engaged with you. You need to maintain that level of engagement or have them be thriving. Some of the warning signs will be where the only time you see physicians is when they're complaining. You really want to have a group of physicians that are not only coming to you with their concerns and complaints, but also solutions, that they're solution driven and they're looking to make it a better place to receive care. Another is if they're not a team player, they're not working well with the nurses and staff. If there's some kind of disruptive behavior, you also want to check to see, are they referring to your hospital or are they referring to another hospital because they have more trust in that other hospital or more loyalty with that other hospital, and really looking at your outcomes. So, when it comes down to it, we know that overall quality of care is a huge driver of engagement. So what does your scores look like around patient experience? And it may be the first step to increase your patient experience scores is to be making sure that you're engaging your physicians, your nurses, and your staff so that they then can provide that care.
And do you have any recommendations for maybe some initial steps that you'd want to take to improve physician engagement?
I think your first step is to find out where you're at, to be talking to the physicians, asking them for suggestions and improvements around their support, asking them how they would like to be communicated to, because it's different for every physician, and it's different for every exec team too on the way that they need to be building those relationships. That's the first step, is that you have to be building that trust with the physicians. Part of that is by surveying them, letting them, be able to share with you their concerns. We always like to include open-ended comment boxes so that you can really dig into the data, and there might be some low-hanging fruit. Maybe there's a piece of equipment that's broken in the surgery suite and you didn't know about it. And so, it's just trying to not only gain more awareness of what's happening, but once you do that, to be pulling those physicians in, having them be part of the solution, having them be part of what kind of change initiatives you're putting into place, sharing with them those changes that you're making along the way, and then resurveying them again to make sure that what you're doing is working. And if it's not, then that's the time that you readjust and come up with some new ideas.
Everybody, you've been listening to Dr. Cindy King on today's episode of Healthcare Experience Matters. She is a Senior Vice President of Physician and Employee Solutions with PRC. Dr. King, did you have anything else to add before we wrap up today?
Sure. So, what I think that we have to be really aware of right now is that we are in the middle of a pandemic. And what I'm hearing from physicians across the nation is that some of their biggest concerns has to do with nursing care right now. So it's not necessarily that a reflection on the nurses that are there or the nurses that chose to stay in that hospital, but they're concerned about the holes. So the nurses that left, and then the traveling nurses coming in, the physicians like to have their team. They like to know who they're working with. And, it is a time right now to be recruiting high quality nurses, not only to recruit them, but to retain them. What we find at PRC, and we did a national study recently, was that nurses that stay, nurses that are engaged, are also the ones that are providing better care. So we see that connection to the HCAHPS scores and the patient experience. To get that, you have to provide those nurses opportunities to have choice, autonomy, that they feel that they can be successful in their and be well trained, that they have that collaboration among the nurses, that they have a good community of support, and then that the nurse administration trusts them. So get the nurses involved in engaging the physicians. Have them be a part of your action plans. Have them be a part of building those relationships with the physicians, because when the physicians feel that the nurses are engaged, they themselves feel more confident in their abilities. The last thing you want is a nurse bad mouthing something that's going on that floor. And so you have to focus on them too, because the nurses really are the lifeblood of the hospital and are representatives of that hospital. And so you want them to be saying positive things to the physicians. You want them to be taking extra care of those physicians and helping support them in that patient care.
I'll let that be the final word for today's episode of Healthcare Experience Matters. Our guest again, Dr. Cindy King. Thank you so much for joining us today, Dr. King.
Thank you. Have a good day.
Thank you for listening to today's episode of Healthcare Experience Matters. Healthcare Experience Matters is brought to you by the Healthcare Experience Foundation, with today's episode teaming with PRC. To learn more, visit healthcareexperience.org. That's healthcareexperience.org.